This episode is brought to you by Netflix. This Monday night, witness the end of an era. John Cena takes center stage for his final appearance ever on Monday Night Raw. One last match, one unforgettable farewell. Come celebrate the legacy of a true WWE legend. Monday Night Raw, November 17th at 8 p.m. Eastern Time, 5 p.m. Pacific Time, only on Netflix. Be there for the moment everyone will be talking about.
What's the latest science on heart health, brain fog, weight gain, and hot flashes? Dr. Margaret Nachtigall was at the 2025 Menopause Society Conference, and she's here to tell us everything you need to know to age better. Hi everyone, I'm Barbara, and this is Age Better. Quick note before we dive in, I've launched a new newsletter on Substack called the Age Better Cheat Sheet, so be sure to check it out. Okay, this week I'm thrilled to welcome back one of our most popular guests, Dr. Margaret Nachtigall. She's a reproductive endocrinologist at NYU Health and the medical director at Pink Medical. Dr. Margaret just returned from the annual Menopause Society Conference, where the newest research on menopause, midlife, and healthy aging was presented. From heart health to brain fog, hot flashes to midlife weight, there are fresh insights you definitely want to hear. Dr. Margaret will break it all down so that you can make the smartest choices for your health. Okay, everyone, get ready to age better. Dr. Margaret, welcome back to Age Better.
Thank you. Hi, Barbara. Great to be here.
I was so excited when I heard that you were going to this year's Menopause Society Conference in Orlando last week, because I knew then we could have a fabulous episode talking about everything that you learned when you were in the room where it happened.
Yes.
Right? And you have a lot to tell us.
Totally.
So
I do.
let's start from the beginning, right? We think that's the best idea. Perimenopause. Okay, tell us about that. And is there anything new that we should know?
Yeah. So I am so excited because it was a fantastic conference that took place in Orlando, Florida. And I took notes. I knew I would be speaking with you. And I really want to share as much information as I possibly can about everything that was covered during the meeting. So yes, let's start with perimenopause. And the person that introduced perimenopause said, wouldn't it be nice if all 45-year-olds were sat down and said, here's what's going to come. In fact, you could even start at age 35 to 45 and let people know what was ahead. What is menopause going to feel like? Just as girls are introduced to the idea of puberty. But that doesn't really happen. What happens in perimenopause is this is a time of great fluctuation. Sometimes estrogen levels are lower, sometimes they're higher. They're basically all over the place. Progesterone levels are often lower, and periods become irregular. Cycles are irregular. And people can start having symptoms. They can have hot flushes. They can have trouble sleeping. They can have moodiness. Basically, one of the most common things that women say is that I just don't feel like myself. Mm-hmm. And that's a sign that perimenopause is here. What can we do about this? Well, one, information. Get ready for menopause. The other thing is that more and more it's being recognized that combination oral contraception, that is a combination of estrogen and progesterone, whether given in a pill, a vaginal ring, or a patch, in low doses can be used safely in low-risk individuals and individuals that are non-smokers and are healthy and don't have other contraindications into the early young 50s, so a 50, 51-year-old. So this is a great way to tide people over from the premenopausal throughout perimenopause into menopause. And the other thing is if bleeding is a problem, then this is a time where a progesterone-only IUD might be very helpful.
Interesting.
Because that will mitigate some of the bleeding. But one thing to mention is that not all irregular bleeding, even if you're in the perimenopausal range, is attributed just to perimenopause. If you're having irregular bleeding, go ahead, go to your doctor, your healthcare provider, so that they can evaluate the bleeding and make sure it's perimenopause and not a sign of some underlying abnormality.
Yeah, that's really great and so important. Let's move on to something that is really a very common symptom, and that's brain fog. Not only brain fog, but also and because that's more short-term symptom of perimenopause and menopause, but some of the longer-term concerns like dementia and so on, risk of
Absolutely.
Talk to us about that.
This was a great area. Dr. Mackey really started us out on the brain. And I think that's huge. We want to do whatever we can do to keep ourselves living the healthiest lives as long as possible, but as healthy as possible. And decreasing the dementia or Alzheimer's is really important. So one of the things that was really addressed is that having hot flushes increases the likelihood of developing dementia.
Incredible.
And anything that you can do to mitigate or get rid of those hot flushes is going to decrease the likelihood of developing dementia. So that's really important. That means that if we treat the hot flushes either hormonally with estrogen or non-hormonally with either what we have now, the neurokinin 3 inhibitors, and now we just got approved a new one, which is a neurokinin 3 and a neurokinin 1 inhibitor. So non-hormonal options for treating hot flushes, or some of the over-the-counter products if that works for you, mind, body, meditation, exercise, all the other things. If you can alleviate your hot flushes, you're going to decrease your likelihood of developing hot flushes. So that's new, and that's a big thing.
Of developing dementia and the risk of Alzheimer's. And what's so incredible about that is that not that long ago, everyone just thought, oh, it's just an annoying symptom of menopause, these hot flashes that might affect my daily life, might affect my sleep. But now we know that they are much more serious than that, or can be.
Right. And, memory itself, 45% of individuals in the 45 to 55-year-old range say that they notice memory changes. So just memory issues alone is a big factor of menopausal symptoms. So decreasing, anything we can do to improve memory is also a huge benefit.
So the takeaway of this is to really have everyone focus on their hot flashes if they are having them, to really mitigate the risk of dementia in the future.
Yeah, exactly. And it was shown that the increased frequency of hot flushes, increased severity of hot flushes, you can see actual signs on MRI where you see more white patches.
Wow.
So it really is something that we should think about and treat, not just sit and suffer.
Yeah. And I'm so happy that more attention is being paid to this topic, and hopefully more research as well. So let's kind of travel down the body a little bit.
Let's travel.
Shall we?
Let's travel.
Let's travel. Yeah. Okay, let's go talk about something that I'm a little obsessed with, body part wise, and that's the microbiome.
Yeah.
What is the connection between gut health, microbiome, and menopause?
Yeah, I think this was very interesting, that there is a gut-mind connection, and the microbiome is so important. I think we need a lot more research to really be able to figure out the details of this, but they had extensive studies and showing that there are differences and that differences really make a difference. They even showed that there was a specific metabolic signature that was associated with different mind experiences. And they showed that depression, for instance, had a different microbiome signature compared with others. They also showed that people that had early childhood trauma, those were more likely to develop hot flushes when they went into menopause.
Wow.
And that the worse the trauma, the worse the profile later on, and an increase in cardiovascular disease. And this also affected the microbiome. So there were a lot of factors here. I don't have a specific take-home treatment or anything. I think just to know there's more on the horizon, and there is an interesting connection here.
Right. I did have an expert on the microbiome on the show not that long ago, within the last year, and he did convey that it's important to have a kind of very varied microbiome and to do simple things like, and I'm sure it applies to this as well, simple things like making sure you have enough fiber in your diet and just to kind of keep your microbiome.
Well, I mean, you did a whole episode on this. We could talk on and on about it. I am no expert on the microbiome, but I think just
eat some beans, everyone.
The thing that came up was just that there is this connection. So it's very interesting.
There is a very interesting connection, more research on that. Okay, there was some discussion about terms like ovarian age and biological age and its connection to longevity. And talk to us about that.
So there was an excellent talk looking at longevity, but instead of calling it longevity, talking about health span and trying to expand the time that we're healthy, which is, I know, something that you're very passionate about.
Yeah, my passion's health span, not necessarily longevity, to be honest.
Exactly. And I think things to look at are frailty indexes. Can you get off the floor without using your hands? That's a good measure of it. We talked about grip strength. And the take-home point here was that the ovaries seem to be really important, and that people that have their ovaries, the ovaries, maybe they're still making something, because people whose ovaries were working longer tend to have a lower ovarian age. They tended to be healthier. So there seemed to be something about this ovarian function that was helpful, and that the ovaries are probably making substances even when they're not making estrogen. So that was important. And I think one point that I took from this is that the environment is also important. So it's important what your body's making, but it's also important what you put into your body, as well as how you move your body. And then whatever exogenous factors, we're exposed to, like pollution and all the other factors.
Right. It's so interesting what you just said about kind of holding on to your ovaries, I guess, as long as you can, because I know that was not common wisdom. Not that long ago, my mother had a hysterectomy, I want to say maybe 10, 12 years ago or so. And I remember they tried to convince her, even though her ovaries were fine, that to get rid of her ovaries while she was there, and she said, she insisted, no, I'm keeping my ovaries. And because at that time, and that's not that long ago, they just said, they're not doing anything for you anymore.
Well, this is something it really depends on what you're focusing on. And there is a lot of controversy. This is a lot of new research in this area.
Right.
But remember that the ovaries can develop cancer. And so removing the ovary eliminates your chance of or markedly decreases your chance of developing an ovarian cancer. And ovarian cancer is still one of those cancers that's hard to find because there often are no symptoms until a late stage.
Right. That's the flip side.
So removing the ovaries may be extremely beneficial for some individuals, and certainly people that are high risk for ovarian cancer, that may be the best thing. People that are carrying a gene that makes them more likely or more susceptible to ovarian cancer, those are individuals that should remove their ovaries. So I think there's a lot more in there, but one of the take-homes on this is just the ovaries are probably producing things. They're probably producing some androgens. They're doing things that may be important for our bodies.
Right. And one more thing, too, that you always say on every single episode that you have with me is that everything should be personalized.
Absolutely.
We're all individuals and our risks are different. So now let's move on to not necessarily another part of the body, but kind of a really common issue for just about everybody. And that is weight management. And so let's talk about that. What are some new developments in that area? Of course, we have the GLP-1s, but
Right. I think the message here was really to focus on the composition and not just about weight. That about 70% of women who are going into menopause will see some weight gain, and 80% are bothered by it. It's an increase in the visceral fat, and we have talked about this before.
Yes.
People become relatively more insulin resistant and without estrogen. And so there's a change in metabolism. There's also a weight gain of aging. So it's hard to tease apart what part of the weight gain is just from getting older versus what is because of that lack of estrogen. But both together certainly contribute to a more difficult time in losing weight and an increase in weight in the middle, that visceral fat, which is the fat that you don't want, that adipose tissue in the middle. It's bothersome, and it also has been associated with a worse prognosis for cardiovascular disease. So certainly something that we want to avoid. What can we do about it? We can exercise. We can eat a more Mediterranean type diet, fruits, vegetables. Protein, really, really important. One thing that I took home from this about actually throughout the entire conference is how important sleep is. That people that have too little sleep, not enough sleep, less than 6 hours a night, that actually will make you more insulin resistant and have your body gain weight. So
Amazing.
just by sleeping longer, trying to get 7 to 8 hours of sleep, you can decrease the likelihood that you're going to gain weight and actually not gain the weight or lose weight. So that's huge. Sleep increases our cardiovascular risk. It increases insulin resistance. It makes us more inflammatory. So we really need to get sleep. And as we know, in menopause, that's a time where a lot of people are experiencing insomnia. I think 50% of individuals will experience more sleep disturbance in sleep, difficulty falling asleep, difficulty staying asleep. This is one of the big symptoms of menopause. So we really have to focus on trying to get good sleep
Right.
habits, and also regular sleep. Not only getting enough sleep, but making sure that we're in a regular
Yeah.
system of sleep. That
Yeah.
was shown
Yeah.
to be very helpful. There was a study that showed that women that had adequate sleep, 7 to 8 hours, and then you deprived them of sleep, they experienced insulin resistance, more cardiovascular disease, inflammation. And then when you were able to give them the sleep back, you could correct it. So that's huge.
That's
And
really
also
huge.
being on a regular schedule really helped.
Yeah. Go to sleep at the same time, wake up at the same time.
Right. And of course, another symptom of menopause is mood. Well, it's tied into sleep as well and hot flushes, right? Because
Mhm.
if you're not sleeping, you're often in a worse mood the next day.
Yes.
And also, if you're in a terrible mood, you probably don't sleep as well.
Yeah.
So I think in addition to wakefulness at night, this is also another factor.
Mhm.
So when you treat one thing, you usually improve the others. So in addition to lifestyle modifications and trying to get regular sleep patterns, eating well, exercising, sometimes hormone therapy is a great option to help you sleep and correct these underlying problems. So that was something we talked about.
Definitely. I mean, yeah, for sure. I mean, that's a really
And
important thing. You know what always helped me, when I was going through that stage was moving my body more. I mean, I found that when I exercised more,
absolutely.
I just slept better at night.
Yeah.
Because I was so tired
Absolutely. That helps.
from it. It did help.
And then back to the weight issue, as you mentioned, the GLP receptor antagonist, the GLP medication, the semaglutide, as well as the tirzepatides, they are fantastic about helping people lose weight. And it has been shown that postmenopausal women on them with estrogen actually made the weight loss even more. So
Wow.
that's really interesting. And that might be the right thing for some people. It is not for everyone. And I think
No.
it's really important. Some of my patients, some of my friends are asking a lot about, well, should I be on it? Well, I really think that that's a question for your doctor. But for the person that qualifies, for someone that has a BMI above 30 or has sleep apnea or has cardiovascular risk or diabetes, these medications are very appropriate. And the results in decreasing cardiovascular disease has really been tremendous. The reports look great in decreasing inflammation. These studies were done on patients where these medications were used and indicated. And so we don't have the information on people who use them where they don't meet those criteria. And I think extrapolating to others, we're really not at a place where we can do that right now.
Interesting.
Mhm.
Well, more to come on that.
More
Because, I
to
mean,
come.
the attention on the GLPs, et cetera, are just incredible, of course.
Well, they are. I mean, they do seem to be making a big difference. And I think the take home from the menopause meeting is menopause is a time of increased weight and decreased insulin sensitivity. And that if someone is on a GLP and hormone therapy, they do better than just a GLP alone.
Yeah, really incredible.
Mhm.
let's go on to another body part, a very important one. They all are.
Yes,
The
yes.
heart. I mean, heart
Oh, yes.
disease, really, that's a big topic. I mean, we've had an episode on just heart health, Dr.
Right.
Margaret, because it's so important and gets so complicated when a woman goes through menopause. So what'd you find out this time?
Well, I think the big things on the heart is going to be something which is going to be my main thing on everything. Prevention, and then some more prevention. I think trying to see what you personally, individually are at risk for, and then really preventing cardiovascular disease, particularly trying to prevent atherosclerotic heart disease. There are lots of other types of heart disease to try to avoid as well. So the key things here were, first of all, at some point in your life, measuring your lipoprotein little a. This is something that is a genetic factor. It is modified. It does get lowered a bit by estrogen, and there are factors that can modify it to small degrees. But overall, this is a genetic factor. So you really only have to get it once in your life. But get that, because if that is elevated, then you are at an increased risk for cardiovascular disease.
There is actually a medication from coming out from Lilly.
Yes.
And in fact, I had the lead author on this study who was at work on this drug on the show talking about the LPA. I had never heard of the LPA test, and she came on to talk about it. And this was well over a year ago.
Right.
She convinced me.
Well, this is not new.
No, definitely not new. But as she explained in the past, the reason why the U.S. medical system did not convey this to patients is they didn't know what to do with the information because it was nothing to be done. Whereas in Europe, everybody gets it once in their lives.
Well, I think now
it's different now.
The answer is it pays to get it because it just gives you a little bit more information on your risk. The other thing, which I think is really big, is LDL. Get your LDL level. That can be changed, but get your LDL level because if that is elevated, that is a risk factor for cardiovascular disease, and that should be treated. And so measure lipid levels.
Absolutely.
And in the past, we know that HDL, which is kind of thought of as the good cholesterol, people thought, oh, if your HDL is really high, it didn't matter if your LDL was also high, but that apparently is not true. You really want to check your LDL, and if your LDL is elevated, that's a risk factor and that should be treated. And you can talk to your doctor about what method is best to treat it, whether it's a statin or something else. Statins do work, so that would be something to treat. The other thing that was really evident is hypertension, high blood pressure. Don't ignore it.
A big
Figure
one.
out if you have it. If you do have it, go ahead and see if you're someone, why do you have it? Evaluate it and maybe potentially treat it. One thing that I didn't realize is that white coat hypertension, which is, you go to the doctor and when you're at the doctor or when you're really nervous about something, your blood pressure is elevated. But when you're at home and you're relaxed, your blood pressure is not elevated. And so I would think, oh, well, that's just when you're nervous, no big deal. But the truth is, it can be a big deal. And so that is something that we should evaluate as well. So if you are one of these people that when you're really nervous, your blood pressure goes up, or when you're in the doctor's office, your blood pressure goes up, that is something that we should evaluate, think about, that might be a sign of some underlying heart disease. So that may increase your risk. So I think that's important. And of course, exercise, keep yourself healthy, be on a healthy diet, all of those things contribute to cardiovascular health. And guess what else? Sleep. Again with the sleep.
Again with the sleep.
This is one of my big weaknesses. I do not sleep enough, and I am
you do not.
I'm committed to make sure that I start sleeping more because I learned how important sleep is. It's important for decreasing inflammation. It's important for cardiovascular health. It's important for weight. It's important for so many factors, and it makes you feel better if you're slept. So getting adequate sleep really can improve your cardiovascular profile.
I'm a huge believer. And in fact, I have an Oura ring that tells me what my sleep looks like.
And I think the other thing is if you're over 50, then if your LDL is elevated, that might be an indication to get a calcium score. Your doctor may suggest that you get that.
I've been pushing
and
that
treating
for
diabetes.
about a year. I don't want to move on from the calcium score test too quickly.
Okay.
I've been pushing that test on people, in my age group or people over 50 for about 2 years since I heard really good information about it. Again, something I never knew anything about, but I think it's an important thing to consider and discuss it with your doctor. The heart, anything else?
I think we went over.
Yeah, pretty amazing. Pretty amazing. Great information. Let's go to bone, one of my favorite
You love
topics.
bone, and it's huge for you, and it's perfect
Bones.
timing because the marathon and bone and bone
that's
health.
Right. That's
so
right.
Bone, prevent, and prevent some more. Identify who's at risk for low bone density and treat or prevent. So that's my answer in there. Prevention was time and time again. We saw study after study after study. And what it showed is those people that prevented their bone loss, it was less expensive, more effective. I mean, this is really true. Less expensive, more efficient, and better for the individual. And it's easier too.
Absolutely. Everyone has heard me say a zillion times that I believe, all of this is important, of course, but the key to aging better is to keep your bones and your muscles and joints really intact for as long as possible.
Right.
And you're right, prevention. So what does that mean? You have to start as early as possible, although it's never too late, everyone. But you have to start early and start working out those muscles. That's one of the most important things that you can do for your body is to exercise those muscles and make sure you don't smoke, don't drink too much, eat calcium-rich foods, blah, 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 right?
Yes, and vitamin D.
Of course.
In terms of recognizing who needs to be assessed and who should get a bone density, although the guidelines say to wait until age 65, if you are a person that is at a higher risk, not waiting until 65. So having a family history.
Kind of teeny tiny bone structure.
Being thin. Being thin is very important. So being thin, not having enough weight on the bones, having a very sedentary lifestyle, someone who's on chronic steroid use, long-term steroid use, family history, just as you said, very important. So those individuals should get assessed earlier because they showed that if you go into menopause, say you start at age 51 and you are in osteopenia, maybe you have a standard deviation of about 1 standard deviation below the normal, which is not that bad. By age 65, if you've done nothing, no prevention, no help, you'll be osteoporotic.
Correct.
So this is why we want to treat early. And estrogen would be a great way of preventing bone loss and all the other modifiable factors, just as you discussed.
Yeah. I don't know if you all saw the 60 Minutes episode that just was this past week with Dr. Peter Attia, who is become the most famous longevity, to use that term, longevity doctor on the planet, in the universe. Anyway, his number one recommendation to everyone is exercise. If you do nothing else, if you do absolutely nothing else to change your lifestyle, is you must get in that exercise, specifically strength training. So I just thought I would throw that out. You should all catch it if you didn't see it. I'm sure it's easily available on YouTube. Let's move to a different body part, very important, breast health.
Yep.
Yeah.
Prevention.
Prevention again, right?
Prevention, assessment. Here, the message was there are many, many methods. You can go online looking at your personal risk. What is your risk compared to somebody else's risk? And things that increase risk are family history of breast cancer, people that have a gene that increases their likelihood of developing breast cancer.
Right.
Smoking increases your risk of breast cancer. So see if you're at an increased risk. If you're at an average risk, then start getting mammograms at age 40, get them annually, every single year. If you're someone that has dense breasts, so about 40% of 40-year-olds will have dense breasts, whereas about lower percentage when they're 80. But every year you should have a mammogram. The radiation dose in a mammogram is really quite low. It's about the same as a round trip air trip somewhere. So it's really a low radiation test. Get a mammogram. If you have very dense breasts, also get an ultrasound or a MRI, or we talked about the VeraScan, a 3D compression-free mammogram, but get a test that lets you assess, because if you can diagnose breast cancer at an early stage, it's going to be much easier to treat. So that would be a huge advantage.
Yeah. And I do want to point out that you were on the show just a few weeks ago talking about a new technology, and it is compression free, and it is available at Pink Medical in New York City and some other places around the country. And I'm going to put a link to that episode in the show notes, everyone, in case you missed it, but you really should check this out. If compression during a mammogram is something that's causing you to not get a mammogram, that we never want to hear that happen. And you must be assessed. And so that's just another option I wanted to make sure we brought up. So let's talk about vaginal health. I mean, vaginal health also that relates to not only the health of the vagina, but also possibly your sex life and enjoying sex. If if you have a dry vagina, this is not a good situation if you're, are sexually active. So let's talk about that. Vaginal health. What'd you learn?
For vaginal health, I really solidified what I knew already, which is there are some great over-the-counter products, particularly hyaluronic acid, which can be helpful. However, estrogen is probably most people, except for people that have breast cancer and are on an aromatase inhibitor, just about everyone else can safely take vaginal estrogen. So unless you have an estrogen-sensitive tumor, that you really can't take any estrogen at all. Other than that, most people can use vaginal estrogen, can be really helpful for restoring the mucosa, bringing back the vaginal elasticity and color, and really eliminating vaginal dryness, which can make intercourse more comfortable, but also day-to-day more comfortable, less dry. So I think it really is the same as where we were before, which is consider estrogen or over-the-counter products to do something to alleviate vaginal dryness.
Right. And it's so important, as you have pointed out in many episodes that we've had together, that this is something, the vaginal dryness specifically, if left untreated, can only usually gets worse. And that can cause a whole bunch of other health issues.
Well, it can increase your risk of vaginal infections and also urinary tract infections. And urinary tract infections can be bad. So yes, absolutely treat.
Yeah. So again, prevention. That was another case, I think, of prevention, which I think is so, so important. So what were there were days and days of incredible presentations, new information, new research shared with all of you in the medical community. So what were and we just covered a lot, but what were your personal biggest takeaways from this conference?
The other thing I just want to mention in the overall meeting was they did have a section on sexual health and testosterone, and that there is no testosterone that's FDA approved, which we have said that on this show, and that testosterone supplement can be beneficial for hypoactive sexual desire, but really doesn't make a significant difference for energy and muscle health, which a lot of people thought that it did. So that's one area.
I'd like to just interrupt you for 1 second. I know you and I both read that article that was in the New York Times just about a week ago. Good timing for the article to come out, right? I'm sure everybody at the Menopause Society Conference was reading it. But it did kind of indicate that there were a lot of women who were talking about how energetic they felt after taking it. So I was curious.
Well, one hypothesis on that is that testosterone does convert to estrogen. And it may be that estrogen, which is making you have that energy and improved mood.
Interesting.
Yeah. So the jury is out. We need a lot more tests. We don't have enough research. That is really an area that deserves a lot more attention and a lot more research. It's hard to do the research. There has been research done on a testosterone patch, but no testosterone is FDA approved right now.
Right.
So it's really difficult to do that research. So that's coming down the road.
Yeah. Do you believe that should change?
I do believe that should change. I think this is a really important area that should be researched. Yes, I do.
No, but I mean, no, the FDA approval for women. Do you think that should change?
I think we need research. I think we need to find out.
To get to that conclusion.
Is it safe and is it effective? And I think that was another message when you asked me what my conclusions, my overall sense.
Takeaways.
One big takeaway was the importance of using FDA-approved products.
Okay.
That these products that are supplements are unregulated. You just don't know what is in it, what is put in. You don't know the right dose. Some of the compounding formulations don't get absorbed as well. And it's hard to measure, and you might not get the same dose from day to day. So I think sticking to the FDA controlled, that we have safety studies on, are the way that I would recommend proceeding. And what I really got from this is how important sleep is. That was really, that
I'm getting you an Oura ring.
That hit home to me, is that sleep is important for your overall sense of well-being, for your cardiovascular health, for your brain health, for your overall,
weight,
for
as
your
you pointed
weight.
out.
Absolutely, for your weight. Thank you for adding that. Yes. So sleep is important. And the other thing is individualize your health, which I have, of course, said time and time again, but prevent disease. Try to prevent your bone loss. Try to prevent dementia. Try to prevent cardiovascular disease. So I think that message, figuring out what you personally are at risk for and trying to be, of course, as healthy as possible, eating well, sleeping well, exercising well, socializing well, being as productive as you can. But I think recognizing that we can have some sense of what we are each at risk for and trying to focus in that direction. So if you're a very thin individual with a family history of osteoporosis, you might treat your menopause differently from somebody who doesn't have those risks. Maybe you're someone that might consider hormone therapy more seriously or more actively, or feel that the pluses are going to potentially outweigh the risks more than someone else. So I think taking all these things into consideration is really important.
Yeah. Thank you so much for that. And my takeaways from everything you've been saying is that those basics, as we view them, exercise, eating well, and sleep are the most important things that you can do for yourself to age better. So this was a good reminder of all of that.
Right. And I think what you've been saying for years is aging better, healthier, healthy aging.
Yes.
Right.
Yep.
So,
healthy aging.
Healthy aging.
It, to me, equals aging better.
Right.
Dr. Margaret, I know you'll be back soon. Yes. I so appreciate it. I couldn't wait to have this little overview.
Me too. I was excited to share the experience. I had a great time. So fun to see all the experts in different areas and listen to their brilliance and just get lots and lots of information and listen to studies and plan new studies. I think that's really important, is connecting and discussing and talking about what comes next and what are we going to learn next.
Yeah, for women's health. And it was so great, too. I posted some photos of you and your mom, Dr. Lila Nachtigall, on social media to say, yes, you're both there. So you went with your mom, which is so great. She's a legend in the field.
Yeah. Well, she is honestly the start of the field of menopause and really is a rock star in the menopause world. And I'm really happy that she's still working and active and really continuing the world of women's health and continuing all of this research. So, yes.
Yeah, she's a great role model for aging better.
Absolutely.
Yes. Thank you so much for joining me.
Thanks for having me, as usual.
and we will talk soon. Thanks for tuning in, everyone. If you enjoyed this episode of Age Better Podcast, please do a few things. First, share it with all your friends and family. Then, subscribe to Age Better wherever you listen to podcasts, including YouTube, so you never miss a single episode. Finally, if you have ideas for topics you want me to cover in a future episode of Age Better, send an email to agebetterpodcast@gmail.com or reach out to me on social media. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.